the entire family and the influence of the wider social sphere to fully understand all of the continuing factors to parental alienation in any one given case. When working with families which there is alienation or estrangement, it is useful to obtain a clear picture, as clear as possible, of the following issues regarding each family member. First, we have to look at the allied parent. Allied parents vary in their individual dynamics. Some parents deliberately retaliate at the other parent in a high conflict divorce by limiting access to the child, while some act out their anger unconsciously by making negative comments and or by their nonverbal gestures in regard to the other parent. A number of parents are generally anxious about the child seeing the other parent due to their experience of the other parent as abusive or neglectful. For some of their concerns, that may be appropriate, but for others, they are usually overblown. Anxious parents may fear letting go of their children because of their own sense of vulnerability. Sometimes the parent has a history of being victimized early in life and carries this sense of victimization to the present. In some cases, the allied parent is not able to tolerate and appropriately respond to the child's full range of feelings because any anger the child might express toward the allied parent or positive feelings towards the other parent feel like a personal betrayal. There is agreement among professionals that negative input from the allied parent is a major factor in alienation, but not all agree that it is a necessary ingredient for the complete rejection of a parent to actually occur. Now let's look at the rejected parent. Some rejected parents have historically been involved parents for whom the accusations of the child and other parents are ill-founded. Others, however, have personality deficits, are lacking appropriate parenting skills, and or have previously been only minimally involved in their children's lives. In these latter cases, it may be that the child's feelings about the parent are reality-based, at least to some extent. Most experts would concur that such cases are better viewed as cases of estrangement rather than alienation. Therefore, it's important to assess whether there is real evidence of long-term psychopathology. It is also helpful to ask the following questions. How is this parent adjusting to the divorce? Has this parent historically been involved with the child? Can the parent empathize with the child and understand the stress the child might be experiencing? What is the parent's view of the other parent and of the child? How well does this parent control their impulses? And then we look at the child. Children may vary in their thoughts and experience that lead to their rejection of a parent. The following are diagnostic questions for children. What is the child's developmental history? What is the relationship history with each parent? How has his internal view of the rejected parent changed over time? Does the child display anxiety, and is this anxiety focused on the target parent, or does it apply in other aspects of his life? If there are questions of abuse, does the child have symptoms of post-traumatic stress disorder? Can the child express a full range of emotions? Does the child mirror the allied parent's words when describing the alienated parent? Does the child's explanation of events make sense, or are there holes and contradictions? Are his reactions appropriate to the stated crimes of the alienated parent? Does the child have flip-floppy views of the parent? Children who reject a parent are often highly anxious. Sometimes this is appropriate to the situation because the child has experienced or witnessed one or more traumatic events. However, in many cases, the level of anxiety is greater than one would expect, given the events that have transpired. Often it is not clear which is the case, but an appropriate plan for treating the child is contingent on trying to understand the dynamics leading to the parental rejection. So there again, we must look at why this one parent may want to alienate the other parent. Then actually you have to look objectively at the alienated parent to see if it was her on their part, his or her part, or because of the alienating parent. And then looking at the child, their background and what they are bringing to the table. And then blending all of these together, we try to get a scenario of what is actually happening in order to diagnose the syndrome. Even though children who refuse contact with a parent often play the rejecting roles themselves, it is common for them to assimilate a view of the rejected parent as not caring about them. The child both mirrors the perceived rejection and filters input from the parent in a way that reinforces the perception of not being cared about. It is not surprising that children in this relational dilemma often have deep-seated feelings that they are not worthy of their parents' affection. Some children flip-flop in their view of a parent depending on whom they are with. Garber refers to such children as chameleons. Chameleon children may appear to be allied with whichever parent they are with at a particular time. They will provide negative reports about the other parent, the current parent, and may indeed believe them to be true at that time. After the transition to the rejected parent's home, their behaviors and their internal views shift. Such children have difficulty holding divergent views of their parents at one time. One chameleon children move from home to home. Their transitions can be full of pain and conflict. In one extreme case, for example, two girls were told by their father that their mother, with whom they had resided with, was extremely emotionally disturbed. And when they came home to the mother's home, they would have refused to take off their coats and would scrutinize their mother, her every move, until they were certain that she was safe to be with. So this is how powerful the comments that a parent might say in the presence of a child. That's just a sample of the effect it has on that child. And I personally believe it may take years for a child struggling with that perception to see, was the one parent right, alienating parent right, or was the estranged parent actually guilty of those accusations? It generally took 2 full days of the girls to be able to trust her. By the 3rd day, they were happily ensconced with their mother, trusted her, and believed that their father was mean to her. Well, all of that is a terrible situation. We all have to remember that life is very short, and while this child is struggling with these divergent views, life is going by, relationships are being severed, and actually this is being replaced by positive development of the child and either of those spouses involved. It's extremely destructive to be part of any type of scenario as this is. The interactions between the family members, the actual family dynamics, is very important. It holds clues as to why a parent is being rejected. It is useful to explore the current and past dynamics of the various interactive subsystems of a family. Was that sort of the affair of the day? If someone did something, then just to walk away? Actually, divorce demonstrates that. If two parents separate, and that actually presents to a child a parting of ways. Now, how that's handled, obviously, if a husband and wife are an alienator and a rejected parent, that path between them is very wide. They're not separating or parting ways. They are building walls, indestructible walls, between themselves, between their children, and all the relationships that they may encounter in their future as everyone of that family unit proceed through life. Looking at the couple actually involved, what were the dynamics of the couple prior to divorce? How did the couple break up? What have been the divorce dynamics? What are the current legal issues between them? Have there been incidents of domestic violence? Basically, parental alienation is a form of child abuse. It's abuse to the alienated parent. It's extremely, once again, destructive. If yes, what form of violence was there in the home and how severe? And has the violence been unidirectional or bidirectional? Well, there you have your crossfire. Have the children been abused or witnessed abuse? It is important to do a thorough evaluation of an alleged abuse and its severity. It is also important to assess the current level of conflict and how it manifests in the legal struggle between the couple. In the case of the boy who believed his father did not care about him because he would not pay for hockey, the parents had been embroiled in a litigation for